fascinating story to share with you today on the show. Hearing from a Grand Rapids mom who survived a massive aneurysm that ruptured in her brain, and the physician at Metro Health who really saved her life. And in the studio with me, and really happy to have Dr. Augusto Elias, who is our special guest. Dr. Elias, welcome.
Thanks for having me this morning.
And Marcia is with us. Good morning, Marcia.
Good morning.
Let's talk about, first of all, take us back to when this was happening. You were preparing for the Irish jig, right?
Correct, yes. I had just gotten up and I was getting dressed, actually.
You're a runner, and never a problem, an issue, or anything.
No.
Okay.
I was getting dressed and ready for the race, and I'd bent over, I was getting my running pants on, and just felt a sudden horrible pain in my head that radiated down the back of my neck. And we were just talking, the neck pain was really the worst part of it.
Really?
It was just terrible spasm down the back of my neck.
And wouldn't go away.
Would not go away.
You're thinking, oh, this is a quick, whatever.
At first, you're just thinking, okay, just give this a minute. But I became really nauseated and felt like I was going to pass out. Just waited for it to go away, and it didn't.
So what happened next?
Well, I called out to my husband and gave it another minute, and then we decided that I needed to go into the emergency room.
Did he take you, or did you call an ambulance, or what?
Well, he took me. He took me.
All right. Now, Dr. Elias, is that the right thing to do?
No, we recommend that we call 911.
Sure. And get the proper treatment right away. For the paramedics could
Definitely.
then potentially diagnose and get the whatever started in talking to the hospital, right?
Yes.
Correct. They are professionals,
Right.
and they know what to do on the field, and know how to take the patients, stabilize the patients and take them to the nearest comprehensive stroke center, which is what Metro is.
Okay, and you said, I want to go to Metro, and why so?
I did. Well, I'm actually a physician assistant. I've worked in neurosurgery for the last 18 years.
How ironic is that?
So I was actually on call that weekend, and I had another PA covering my call for about 5 hours that morning. So we were on call out at Metro. So I said, take me to Metro. And so I had the advantage of letting my surgeon know.
As a medical person, and you're having these symptoms, are you denying? Are you in denial at that moment?
Oh, definitely.
Yeah.
Oh, completely. 100%. I think I was in denial, probably to the point where they took me to the ICU and put the drain in my head and took me to surgery.
Wow. This isn't really happening.
I kept saying that in the emergency room. I said, no, I don't have time for this. Like, I can't do this.
Dr. Elias, what is an aneurysm?
So, and an aneurysm is a weak spot, sort of like a bleb in the vessel, in the artery of the brain. Mm-hmm. And what happens is that due to modifiable risk factors such as high blood pressure and smoking, which predisposes people to have that aneurysm rupture, or other factors such as non-modifiable family history would be one. Connective tissue disorders can also lead to this weak spot in the vessel.
And then, how do you identify if it hasn't burst? And you had obviously it burst, and that was the pain.
Yes,
but it haven't done that yet. How are you able to identify anything like
so
that?
Unfortunately, no. I mean most aneurysms are found incidentally when patients are being worked up for something else. Like they get a CT scan, and for headaches, for example, or sinus pain. And we found them incidentally. Unfortunately, when we don't know they're there, and then we only know when they rupture. And 30 to 50% of people don't even make it to the hospital when they rupture.
Pretty darn scary. It's not like you go to your physical and say, okay, we'll do this test, we'll do the blood test, and by the way, we're going to do a brain scan. It doesn't happen.
No.
Right. So, other than the symptoms, and basically, you described your symptoms. Are those pretty general?
Those are classic symptoms.
Yeah.
Marsha had the classic symptoms, which is, meningeal irritation. The brain coverings get irritated because of the blood, and those cause the neck spasm and the thunderclap headaches. The worst headache of life. It's what we describe them as.
Okay, and get treatment immediately. But you said, did you say 50%?
30 to 50% don't make it to the hospital, unfortunately. And then out of those that make it to the hospital and get treated, another 50% die within the next 21 days in the ICU. So it's a devastating disease.
How lucky do you feel, Marcia?
Incredibly lucky.
I mean,
Incredibly.
divine intervention
Yes.
or something.
Yes. A lot of divine intervention, a lot of good medical care.
Well, all right. So, and then
a
what
lot of
happened?
family support.
Yeah, really.
Yeah.
But it could be devastating. It could
Yes.
have destroyed much of your brain
Yes.
functions or whatever.
Definitely.
And so, what happened? What's the process after that? After the surgery?
So after the surgery, I was in the ICU for about 14 days. And during that time, they're just controlling your blood pressure, controlling the intracranial pressures.
Are you awake?
I was. Luckily,
Okay.
I was.
Okay.
You know, in a lot of cases, the patients aren't. But for me, I actually was. So
That has to be so out of body experience
It was.
because you've been through that.
Yes.
And with other patients, and
Yes.
suddenly you're lying on the
Yeah.
on the bed.
It was really difficult because your mind goes to just everything that you know as somebody that works in this field, everything that you know that can go wrong and very frequently does. So it was tough. I had to really focus on staying positive. And, you know, it helped that I've got kids and, you know, my husband was there nonstop and
That love
my
and support,
family
yeah.
and my friends. I just had
Huge.
so much support. And even the support of the staff that I'm friends with, so many of them, they just gave me so much love and support.
What about the recovery process then?
So recovery, I went to, I did go to Mary Free Bed for a week after my 2-week hospital stay.
To
I had
redevelop or-
left-sided weakness
Okay.
After surgery just because of a ischemic stroke that also occurred from just my body was trying to clot off the bleeding aneurysm. So
Interesting.
so I did end up having left-sided weakness that I had to work on and regain. And then there's all the issues with just your brain memory and confusion and things like that you have
Yes.
to kind of work on.
Probably still a little denial in there.
Oh, sure. Yeah.
Still isn't happening.
yeah, definitely.
Still not having it. So how long was this process?
So I was at Free Bed for a week. I did outpatient rehab for about 2 months. And then since that time, I mean, I still focus on doing weights and walking and just cardiovascular exercise.
Dr. Elias, is there a way to prevent this or taking better care of ourselves or medications or something?
So like I mentioned before, for aneurysms, we can prevent them or lower the risk of rupture if a patient has them. And that there are two main factors. One is blood pressure control, and then the other one is not smoking. Smoking, nicotine, and the combustion of the smoke of smoking cigarettes causes irritation to the arteries, to the lining of the arteries, and weakens them. So those are the two main factors. The other ones, unfortunately, we can't control. With our family history, we can't control, or having a systemic disease, we can't control.
If someone has that in their family history, should they periodically have other kinds of checks? Should they ask for a scan?
Sure. So we say if you have two first-degree relatives, you should get a screen. I'm a little bit more aggressive with that screening process, and I'll say, if for example, Marsha's offspring should have a scan.
Okay. At any age, or when
So
would you start
usually
that?
in the early 20s is when we usually recommend.
Okay.
Now, there's no set process or recommendation by the American Stroke Association for this, but usually that's when we start screening.
Metro Health has such wonderful care, and you talked about that. That's the place you wanted to go. Describe that, Metro Health, and what you're able to offer patients out there.
So we have the highest standard of certification for the management of strokes, both ischemic, which is when the clot forms into the brain, or hemorrhagic, which is what Marsha had when there's a brain bleed. And that's a very vigorous process to get certified, which is from starting from the EMS service all the way through rehab. So the whole process, even including emergency department, the procedure, and the ICU. And we have to have all these key things in place in order to get this certification, which takes years to get to that level.
Wow. Congratulations.
Thank
Metro
you.
Health, University of Michigan Health. And we're talking with Dr. Augusto Elias and Marcia, the young mother who suffered the aneurysm and has gone through lots of rehab. And do you consider yourself back to normal?
Not quite, but I'm really close. I'm getting there.
Yeah.
I still deal with fatigue. And,
Okay. And are you monitored more closely now?
Yes. Yeah,
Okay.
definitely.
Periodically. For more information, how would someone get to Metro Health, or a website to go to?
So metrohealth.net is one of the websites that you can get more information and see and evaluate the comprehensive stroke program there.
Sure. All right, metrohealth.net. Thank you both so much for coming in. So many things to ask and so many things to talk about, never enough time. Metro Health, University of Michigan Health and Stroke, metrohealth.net, and then maybe /stroke or something that would take you directly to that information. Thank you again, Dr. Augusto, Elias, and Marcia. Best wishes to you.
Thank you.
842, 100.5, The River.